Hi, it's Rod Rourke. Welcome back to Rourke Knows Podcast, helping you become a better you. And I can't think of anybody more perfect to start my podcast than Dr. K. Dr. K. Durey-Raj is actually an amazing facial plastic surgeon in California, and we've known each other for almost a decade. She's a master surgeon, a master injector, and I've learned so much from her. And we're going to talk about a lot of things today. But we're going to start out with some beauty secrets. And she also has an amazing podcast. Kate, tell us what your podcast is and how often you do it.
Well, thanks, Rod, for having me and all the kind words. It's a great podcast. It's called Beauty Bites, Secrets of a Plastic Surgeon, and I do it twice a week. We're almost up to 550 episodes, which is amazing. That you got to have the stick-to-itiveness in life. When you start something, you got to stick to it, right?
Yep.
That's a lesson I learned from you.
That's right. Well, we're going to learn a lot from you today. So you talk a lot about beauty secrets, and let's talk a little bit. We'll dive right in, into like the top beauty secrets. You're right in the, Beverly Hills in the heart of Hollywood. So tell us a little bit about the beauty secrets that you love to talk about and do with your patients. And we'll start out with what today are the things that help your patients to look their best and be their best?
I'm a big advocate for great skincare because it's wonderful when patients can see me 3 or 4 times a year for injectables, but it's the everyday daily things you do that are going to move the needle and make you look tremendously better. So I put every patient over 30 on Retin-A product at nighttime. Everyone in their 20s and beyond needs to be on vitamin C, and I'm a big believer in a 20% strong vitamin C to get you lighter, brighter, tighter.
Right.
And sunscreen should be a religion every day,
right,
whether it's cloudy or not. So those things go for every patient. And when you're in your 40s, I get people on stem cell growth factors. And then talking about injectables.
Tell us about the stem cell growth factors. Like, which ones do you prefer?
Well, so I have my own brand. It's called Transform Stem Cell Growth Factor, and it has cultured medium from human-derived fibroblast cells. And these cells are bathing in this youthful ingredients of cytokine, stem cell growth factors, TGF-beta products that when you apply topically, a certain amount of penetration does occur, and it teaches the cells there to behave normally and more youthfully. This concept of autophagy, where your body has to gobble up old cells that are becoming zombie cells that are occupying space on your skin. When we get rid of those zombie cells and we turn on youthful growth factors, the healthy cells populate really nicely.
So you use it at night or with Retin-A, which is obviously turning over your cells? Really? So you do it with it?
In combination therapy,
Okay.
And I'm a huge believer for treating the neck. This is like the dead giveaway of age right here.
Right.
You do everything to maintain your face, and then someone just has to look at your neck and immediately can tell what decade you're in. So if you don't take care of your neck, that's hugely important too.
That's true. So what about any supplements? Supplements you talk to your patients about?
Awesome. That's one of my favorite topics. So I am a big fan of collagen peptides. As we age, we lose 25% of collagen production by age 40. And we just don't manufacture enough peptides to drive the factory of collagen production. So I love collagen injectable biostimulators, but more important is eating enough daily protein. So 1.5 grams per kilogram of body weight, I highly recommend, so we don't get gaunt, so we continue to have muscle mass and we don't have sarcopenia.
So is that with whey protein, or what do you tell your patients?
Well, actually, my collagen peptides have protein in them. It is a whey protein, yes. So adding that to coffee or to a smoothie, and also just like the equivalent of an extra chicken breast per day, like that. You cut that up, toss it in your salad. Make sure you have heavy morning content protein. Those things will really drive your metabolism. So I personally, for supplements, do collagen peptides every day. I take NMN, which is a nicotinamide adenine mononucleoside, which is a really important factor to stimulate the ATP production in the mitochondria of the cell. So I'm starting to do more supplements that focus on mitochondrial aging and health. I hope you are too. I'll do vitamin C every day, vitamin D, magnesium at night, which has really helped with sleep and gives me a lot of muscle relief. So those are kind of my core products.
What about
resveratrol? Resveratrol is also awesome, and ginkgo. Those two I'll sometimes add. I'm kind of an all or none girl, so I will do a lot of supplements, and then I'll go for a period of time where I'm like, I'm not taking a damn thing, just having a Diet Coke, and fall off the wagon for a bit. But so I've been going off and on.
Yep.
But resveratrol is great for anti-aging too.
Yeah, no, I think M&M is good. I've been starting to take that in the last 6 months, and I think, creatine is good too. It's a good protein, and actually it helps with restore your muscle mass and stuff. And so I think those are all good, very good things to do. I think all that is, by the way, very scientifically proven and very safe. All those things that Dr. K mentioned are all very safe, and I actually tell my patients the same thing. And I think your skincare about the use of stem cells is actually a very good thing, because it certainly will kind of boost what you're doing with retinols and stuff. And so, but so let's tell us about so those are the kind of the maintenance things everybody's on. So tell us about injectables. I know you talk a lot about the neck in your Instagram, and I think you're right. I mean, it is a dead giveaway. Your neck and your hands are the giveaway, I think, to aging, because we can do a lot of things in the face. So tell us about how you manage the neck.
Well, starting with a very emollient-rich, lipid-rich neck cream, because the skin cells of the neck are different. They just don't make oils as they normally should. I never put Retin-A on the neck. I think should not be done. It's like, putting a scorching fire on those oil glands and drying them out. So you want really emollient lipids moisturizer. I'm a big fan of treating platysmal bands, of course, with neurotoxin. I love a good Nefertiti lift where we're able to treat above and below the mandible and give a real crisp jawline. And most recently, we've been doing a lot of biostimulators for the neck. So when the dermis thins, the neck just looks crepey and has like a tissue paper quality. That is something that's so hard to reverse, but using hyperdiluted Radiesse and Sculptra have been really game-changing to grow.
For the tech neck and those transverse lines. Like you don't have any. I like it. So you have had that done. You've had used blended Sculptra, which is a biostimulator.
I have actually done hyperdilute Radiesse in my neck, and for patients, I do sometimes Sculptra when they have more thinning and we need to see a little more padding. It's difficult to differentiate like what gives you better results with creating neocollagenesis. I don't know what your thoughts are if you think hyperdilute Radiesse or Sculptra gives more volume. So sometimes I'll do hyperdilute Radiesse for crepe texture. I really feel it improves the textural change. And then I'll use Sculptra when I want to see more padding and dermal thickening. That's been my...
Yeah, no, I agree. And they're both, biostimulators are actually a hot topic. We've all used them for a long time, but basically they stimulate collagen. One does so innately, like the Sculptra, which is actually... has some inflammatory stimulation of collagen. And actually there's some new data to show that it may actually show and form neocollagen, but that's not published yet. But Radiesse stimulates collagen, so both of them are fantastic. And then what about PRP as a biostimulator? You like that as well? I like it around the eyelids.
I do like it around the eyelids. I just feel like it's very subtle. So meaning it's like putting fertilizer in the garden. Does it help? Yes. Is it dramatic? No. Does it take multiple sessions? Yes. Every season you have to re-fertilize. And so it's a wonderful byproduct that improves the extracellular matrix and the quality of the tissue. So I love it for that. I've been experimenting with SkinVive for the neck, really intense hydration of injection hyaluronic acid right into the dermis. And then I also kind of discourage patients from doing high energy devices in the neck because in so many case reports of people thinning, their neck tissue thinning from like Ulthera or Morpheus or, high energy micro needling devices. So do you see that in your neck lift patients? 100%.
I mean, I like to discourage it, especially since I do a lot of facelifts. So, and I really think that it really makes them a lot harder, especially in patients that have very thin skin. I mean, if you have thin skin, all of those energy devices really make it hard to distinguish the facial planes when you're doing a facelift, as you know. So I would say if you have thicker skin, younger, I think it's okay to use some of that energy. But boy, as you get older, I don't think it helps you. And I actually like, I think some of the skin boosters that are coming out, SkinVive's one, and I'm going to ask you to tell our viewers what that is. I think the biostimulators with the skin boosters are good. I think in the neck especially, because really there's not a lot of good solutions besides the biostimulators. I mean, I think with the biostimulators, I also do use microtox with it as well, because if I flatten the line, but then I also microtox it to soften it in the myofibrils. So tell us about the skin boosters, and there's a new one that's come out recently.
Yeah, the new one in the U.S. is SkinVive from Allergan, and skin boosters are wildly popular in Europe. Like women from America are flocking to Europe to have Profilo, one of the more popular skin boosters over there. And so it's great to finally have it in the U.S. And it's basically a low molecular weight hyaluronic acid. It's not tightly cross-linked like some of our other hyaluronics, so it does break down and degrade a little faster. It lasts about 6 months, and it's injected right into the dermis. SkinVive has Bicross technology, and patients are reporting like nice results with a dewy, hydrated appearance of the skin that really is maximally effective at 2 weeks, kicks in and lasts for about 6 months. So I like it it's FDA approved for cheeks for treating of the face, but I've been trying it everywhere. It's pretty nice. Décolleté, neck.
Yep, same here. I've been doing it in the cheeks and the décolleté in the neck. I think it's great. I think it's it's all these things that nothing replaces what you just said at the beginning. Great skincare, sunscreen, the retinol, stem cell, and all those things. Those are kind of the background of what we all need to do, before we do anything else. So I think, and like your skin looks amazing, and you obviously, you follow what you preach. And so I
think we have to. That's why I love you, Rod. I always see you doing hot yoga and exercising and inspirational talks on the beach and like the things that make you a full person. And you can't expect to live in this fragile human body for 80, 90 years and not do maintenance. Like that's like no maintenance on your car. Like, what are you going to do? How are you going to drive this vehicle?
Exactly. Even if you have a Porsche, you got to fix it. You got to take it in for some tune-ups. So no, I know. I agree. I mean, fantastic advice from Dr. K. So why don't you summarize for our viewers? So what are the must-dos, that you talked about, from skincare to supplements to when you should start doing Botox? And by the way, do you believe we should do prejuvenation and Botox? So if a 20-year-old comes in, so before you give us your summary thoughts, so if a 20-year-old comes, I mean, you're in LA, so 20-year-old comes in, she's, wants to, look great, has no wrinkles, and she says, I want to get some Botox.
Yeah, I see that every day of the week here in LA. People have the FOMO, like the fear of missing out. Sometimes I think our marketing is too good because we're, going in at that subliminal level where you feel like you're missing what everybody else is in on. So, you don't need it. If you don't have wrinkles, don't do it. Just wait until you want to treat something preventatively. With the first sign of repeated crinkles and static lines at rest, then you start. So I started at 27, 28.
I agree.
And I've been doing it off and on for most of my life. And I think that's given me a lot of nice soft skin. Skin's like a piece of paper. You repeatedly fold it, you're going to have creases.
Yep.
So I'm a big fan of maintenance. I'm also, paradoxically, in this industry, a fan of retaining movement. I just think that the frozen, shiny, thin-skinned look of the 80s is over.
I agree.
I want our patients to have none of that. I actually think facial muscle should not atrophy from overuse or disuse, atrophy from too much toxin. So I advocate for, I myself sometimes let it go and leave it alone for a few months, and then I'll come back to it. But it does really give you a beautiful, tighter, smoother skin look. Once your Botox kicks in that second or third week after, you feel pretty amazing.
Yep, I agree.
Do you agree?
I totally agree. No, great, wise words from Dr. K. So summarize for our viewers, key skincare, nutraceuticals, and when you start.
Yeah.
Yep.
I think we have to put a big focus in aesthetics on like treating the whole person and making sure we're not just worried about external beauty. So I want our listeners and our patients to focus on not only how long can we live and how good can we look long, but the health factor, like
Right.
longevity, health span,
I agree.
and doing the hard work. Like the number one way to stay young and healthy is still going to be exercise, building good muscle mass, and taking in good nutrition, and just doing the preventative care. And then I think skincare is so critical. It's the biggest organ of the body. When you take care of the outer polish, like you just feel better about yourself and everything functions better. And then I think judicious use of injectables with a heavy emphasis on things that grow your own collagen, like microneedling, biostimulators, and then using filler in micro droplet, small amounts. Like you are a surgeon, I'm a surgeon. I say we place filler with surgical precision so that the face is not overfilled and it's in all the right places. So those are the things to make sure that you're staying healthy externally, internally, and then supplements, which will improve DNA breakdown, the process that makes our cells old and not replicate well. Because eventually this is the science that's going to drive our industry, longevity and anti-aging.
I agree. Wise words from a wise woman. And Dr. K, who's in LA, I must say, I agree with everything you say. It's fantastic. Keep moving, and in heart, body, soul, but also allow and do things that not freeze your face. So keep your face moving and keep it looking natural and youthful. I mean, it's so good to hear that, because I see so many patients from the West Coast that's not the case, and I know you have nothing to do with any of those, but it's so amazing that, you want people to look good, and now less is more, and not just that overdone look, and because people, they want to look as good as they feel. They don't want to look like somebody else. So it's phenomenal. So great words from Dr. K. And I can't wait to be on your podcast as well. And tell us again, you do it twice a week, and your podcast is on Apple and Spotify.
Yeah, everywhere you can listen to podcasts, iTunes, Apple, Spotify, iHeartRadio, and our Instagram's Beauty by Dr. K. If you're ever in Los Angeles, you definitely should come by and visit.
All right, that's great. Well, thank you so much. It's been a pleasure to have you with us. All right.
My pleasure. The pleasure is mine. Thank you, Ralph.
Yeah.